Why can't we hear you?
Okay, I had to turn myself on.
There we go. Hey, Lynn, how are you? Let me introduce everyone to Lynn Briand. Lynn Briand is a superstar up in the Buffalo, New York area. Works really closely with Sharon Lawrence, but is growing her own team and her own group. And Lynn, you just received the nutraMetrix Consultant Challenge Award while we were just down in Greensboro. And what was quite impressive is that you also had a team member win the challenge with you. And she was only one of 2 people that won 2 challenges. She won both the NC Award and the TLS Award. So a shout out to your team, Kim Fenter, as you're doing ABC pattern. But Lynn, you have a corporate sales background like I do. So when we talked about doing this webinar together, Lynn disappeared. Hopefully she'll come back. I'll brag on her for a second. You're gone. Thanks for bearing with me, guys. So thanks, Heidi, for saying I was awesome. We're all awesome. So Lynn has a corporate sales background, and she's one of the best that I know about objections, about follow-up, follow-through, and working as a professional. So I'm going to go through a little bit of info that shouldn't be new for anyone, but it might be. And so as you guys hear what I'm about to say, just go right ahead and chime in. Uh-oh. What happened here? Let's see. This is definitely a little sticky, this technology here. I might have to go back to some old technology if this is going to be so silly like it is. I'll keep my slides here in this kind of mode. Hey, Lynn, I think you're back. Lynn, I can hear you. Can you hear me? All right, I'm just going to roll through until Lynn is here. But let's
Sarah,
just go through.
Can you hear me?
I can hear you now, Lynn. Yeah. Lynn, can you tell everyone a little bit about your corporate background and why you wanted to do this webinar? Lynn? All right. Guess Lynn's still having some technical difficulties. Just chime in when you get in. But let's just talk about, I mean, health professionals are busy people. And there's many different sales representatives from various industries that are trying to book appointments with them. You can think about credit card processing, people for websites, different pharmaceutical reps, people trying to sell them equipment, people coming in and talking about payroll, talking about insurance. I mean, we always think that we're competing with just pharmaceutical reps, but there's so many different vendors that come in, and health professionals not only have to talk to the patients in the short amount of time that they have, but then they have a lot of follow-up paperwork as well. So it can be kind of crazy to be able to get their time. So here's just some, objections and some quick tips for you. And one of them is to always have a warm smile and a positive attitude. I like to smile even when I'm on the phone. And what I do is I just start with a big giant smile and start talking. And I've spent some time out in the field. I am so surprised at how many times, I guess my smiling is making me yawn. I am so surprised at how many times people go in and when they're so nervous, they forget to smile. The other thing is people will lead a lot with what they are. Hi, I'm Sarah. I'm with nutraMetrix. Have you heard of us? And not why you're there. And so I think if your passion and your enthusiasm for what you're doing, your mission, when you lead with that, it can be quite contagious. And I think if you follow a lot of these tips, you're going to not receive as many objections as you think. And I'll tell you guys some stories as we go through. And so something that I might say if I was going to someone in the area, I'll give you an example. I just I started engaging with a physical therapist. Hold on a second. Down the street. And I said to him, hey, Andy, I know we were connected through a mutual friend of mine, Amanda, and I live right down the street. And I'm a mom. I also work with a company, but I also a national healthcare company, but I also do a little bit of consulting with some local practices. And so I'd love to just meet with you, and I'm looking to expand my network because it's always great to know some like-minded people. So when he realizes I'm a mom, I live right down the street, a little bit more about the mission and what I'm trying to do, I think that that's important. Always be on time. Always, always, always be professional, be courteous. Keep your appointment short. In pharmaceutical sales, we called this be bright, be brief, be gone. And so 10 to 15 minutes is really what we need to do. Am I breaking up, or is it just Lynn? Lynn? Maybe it's your bandwidth, Lynn. I don't know if anyone can tell me if they think I'm breaking up or if it's just on Lynn's end, because Lynn keeps going in and out. Lynn, are you there? Nope, we still don't have her. All right. I'm good. All right, good. I don't know, Lynn, it might be your internet. I don't know what's happening. The other thing is I sometimes will offer to meet outside the office. I do that a lot of times, especially when I'm working with an account, especially as we're ramping up. I will say to them, let's meet outside the office. But Lynn, Betsy's saying you might need to close all your other browser windows. So you might want to try that, close your other browser windows, and that might give you a little bit more bandwidth. I will try to meet health professionals outside the office at some point in the beginning, like 6 months of us working together. Lynn, I'm getting a little bit of feedback, I think, from your audio. Oh, now it's done. Can you chime in, Lynn?
Can you hear me?
I can, yeah.
Okay, I took my headset off.
Oh, maybe that's why. All right, maybe it wasn't working. Lynn, could you tell everyone a little bit about your corporate background and experience?
Of course. I am a registered nurse, but I never really worked as a nurse. I worked for a medical device company as my first sales job, Medtronic. It's a big cardio and neurological company, Fortune 500. And my very first sales training was 2 weeks of boot camp where they video recorded us day in and day out, presenting and handling objections. So I love objections.
Yay. Awesome. Awesome. Yeah, no, I had a similar experience when I worked with Warner Chilcott, 2 weeks of the same thing. And then with my experience with restaurant.com and Living Social. So I think once we get into the objections, just in a couple more slides, I think we'll be able to both give some really great feedback. But I think Lynn would agree that relationships with the staff and relationships with the practitioner, and once you can kind of bridge that practitioner from just a nutraMetrix conversation with just you to getting into a GMTSS event, an overview webinar, an HP course, something where they're seeing it's not just about you, that there's a company behind this, I think is really then when the whole relationship with nutraMetrix is transformed. So I try to get them into something like that as quickly as possible. This is a tip. These all came from the nutraMetrix Getting Started guide. If anyone hasn't recognized this, I just put them into a slide format. But this is what the Getting Started guide says. It says if you're having difficulty with the health professional, you could go to a staff member, the office manager, perhaps, to see if nutraMetrix could be a good fit. I always try to go with the health professional first. If I can't, I'll then try to find an ally within the staff. Something that I see a lot of salespeople do, and so this isn't just specific to nutraMetrix, but I think a lot of you guys are doing this as well, is you make really great relationships and spend time with people that really have no authority. And so it ends up being a little bit more social, and you're not focused on the results and the result-producing activity. I know even when I was a pharma rep, I had colleagues of mine that would say that they had the best relationships with their offices. The staff just loved them. They could spend hours. They could go wherever they wanted in the office. But at the end of the day, you know, you're not going to get paid on hugs and high fives, right, Lynn? I mean, you're going to get paid on sales volume. So did you see some of this when you worked for Medtronics?
Oh gosh, yes. Yes. And you know, sometimes those people can be a little bit of background on the office politics. Spend a lot of time with them.
Yeah, yeah. No, right. And so you don't want things to get too just gossipy, or you know, you want to have that fine line where you're always being a professional. So sometimes objections actually don't come up in the beginning. Sometimes you get through the discovery, through the proposal, you even get the account signed up, and it's during implementation where you realize that this is, you know, where the rubber's hitting the road, and you're asking them to recommend products, you're asking them to place some orders. And now all of a sudden, all that great education, the great tools that you talked about, the HP actually isn't really comfortable with a specific strategy. Don't be afraid at this point. Don't be afraid at any point, guys. I mean, as Dr. Mason says, no one's going to take away your birthday. So, you know, you're not going to lose everything. This is usually just a question in disguise. It's a really great way for you to understand exactly what is holding people back. I'll often try to even draw out objections so I can figure out how we can get over them. And so when a health professional or a staff member has an objection, you know, use these following steps. And so thank them for sharing it. That's what I'll say. I'll say, thank you so much for sharing that with me. And then I'll clarify so I understand. And this is a really great tip, to be able to put what you think they're saying back into your own words, present a solution with facts that are going to help overcome the objection. At this point too, you could also do feel, felt, found. You know, absolutely, you know, Dr. Briand, I know exactly how you feel about this. There's a lot of other doctors that feel the same way, and they have actually found that the isotonic delivery system is X, Y, and Z, that our form of, you know, pycnogenol is a superior antioxidant because, and ask for some sort of agreement. So, you know, based on everything I presented to you today, Dr. Briand, I mean, wouldn't you agree that pycnogenol is the superior ingredient to recommend? And make sure that you've lessened the concern to be able to just say, like, do you feel more comfortable moving forward? Is there any other reasons why you wouldn't be able to recommend OPC3 to your next patient who had some complaints? Lynn, do you want to add anything to just the semantics of overcoming objections?
Not yet.
Okay, yeah, those are all things.
I'm sorry. One of the things, like in that scenario that you just presented, sometimes I'll say your comfort level with our products is of utmost importance to us. Why our medical director will actually schedule a conference call and talk to you doctor to doctor.
Yeah, and that is definitely
right. Would you like me to arrange that call for you?
Ooh. Yeah. I even like to give, instead of a yes or a no, an either or answer too. I mean, I love the way that you had that, but I might say, I'm happy to arrange that call for you. Is during the workday or or a later time in the evening better for you?
Right.
All right, let's get into some objections, and this might be helpful. So this is one. Lynn, I'll let you answer this one first. I don't know enough about nutrition to give advice.
Doctor, I understand that. My own son is in his residency, and I know you don't get a lot of education in med school on nutrition. So many useful for you to help you in your journey of nutrition. Something you would like to learn more about. Otherwise, we can use our website to guide your patients towards products that are suitable for how they answer our NutriPhysical.
I love that. I will often myself get them to agree to something that I'm pretty sure that they already recommend. So I might say something like, doctor, how about vitamin D? Is that something that you're currently recommending? Or doctor, is there any reason why, you're not comfortable enough with a nutrient like vitamin D or a multivitamin for you to be able to give some advice on that? Do you ever try that, Lynn?
I do. Yeah. And just to piggyback off of that, I might also say, doctor, what are some questions on nutrition that your patients are asking you? And how are you addressing it currently?
Yeah. I also will sometimes use a hyperbole. And, I'll say, oh my gosh, I can understand that would be a concern. And that's why, we're not even going to talk about yet putting in a comprehensive weight management program, because, that would be you spending some intensive behavioral counseling, anywhere from maybe, 15 minutes to an hour, which is what some of my other accounts do when they're actually giving nutrition advice. This is us utilizing some nutrients in a therapeutic way. And then I might even, again, go back to like the vitamin D example.
Right. Another thing I like to do is I like to reference the vitamin D and omegas, because there is a prescription omega, so they are very comfortable in that realm of prescribing omegas, B12 for people that are deficient in Bs, and the vitamin D.
Yep. Those are all really great ones. And I think a multivitamin as well. All right, let's go on to the next question here. No time. I have no time. Lynn, what do you think about that?
Oh, who does, right? Doctor, I totally understand. If I could show you a turnkey system that blends seamlessly within your practice, would that have value for you and your patients? And again, that is a yes/no question, which you're not supposed to ask, but that one works really well for me.
And I think that when it's like would that provide value for you is it's a little bit more rhetorical than asking them to do something like, would you like to get on a phone call? Would you like to do this? So I agree with you. I like those buy-in questions, like would that be a value? Are there any other reasons why you wouldn't be able to recommend this? Questions like that, I'm okay with the yes, no.
Right. And then another one I have utilized is, doctor, if we could work with a staff member outside of your office hours that expressed interest, and we could leverage your space here to hold education and weight management classes, could you see that working within the practice?
Yep, that's offering that with working with the staff. You could also tell a testimonial about another practitioner that's even busier than this particular practitioner. You guys all heard, right, from stage, Dr. Ed Flores. Dr. Ed Flores has 4 kids. Dr. Ed Flores is triple board certified. Dr. Ed Flores has a crazy busy hospital job. And he makes time for it. And so, using those kind of testimonials, talking about some of the providers that and just saying, I totally get it. And of course, there's going to be I always just say too, I'll try to qualify them. I'm looking for providers that are at least going to spend a little bit of time, because they're going to have to learn a little bit about the product. And so, I'll sometimes even turn it back on them And, just like Lynn said, like, would it be worthwhile? If we can make this worth your while, it's just like anything else that you would add or bring into the practice.
I also think when they say no time, it's just a nice way of trying to get rid of you.
I agree.
Without hearing the full story of what we have to offer.
Yeah. Yeah. I mean, you have to sometimes look at the objections. Sometimes they are just a nice way of people saying no. So it is hard to judge, like, when is it a question and when is it a block that you need to overcome? And when is it just a polite way of them saying no, thank you? I wish people, Lynn, would just say no, thank you. It's so much easier, don't you think?
Absolutely.
Yeah. How about this one? Why do I have to pay a fee?
That one I'll answer in a few different ways. Included in that fee, doctor, is a multi-million-dollar, billion-dollar website that is included in that allows your patients access to the latest science in health and wellness. It also allows you to have an e-commerce site that automatically takes Visa and MasterCard for that, subscription fee and that monthly fee of $20. I don't think you could find that anywhere to offer what we have with that fee.
I talk about the clinical reference guides that are dynamic, that they have access to, the access that they get to our clinical director and our entire staff support, and the peer Facebook group that they also get access to.
I will tell you, I rarely get this objection. I don't know if it's an objection out in the field, but we rarely get this particular one.
Yeah, I don't, I think because I tell them all of the things that are up front, so it doesn't sound so much like other vendors that they use. But when I think which I'm happy why at the beginning I talked about, you're going to lead with your why, you're going to show why you're different. So you're not just another vendor. Because if you're comparing us to, I don't know, whoever supplies their paper supplies like WB Mason or Staples, there's no fee to have an account there. So yeah, it's a totally different animal. But when you look at what, all of the things that we have to offer, it's just different. It's almost like an association.
Right. And if they have used the no time objection, you can turn it around and say to them, doctor, for that monthly fee of the $20, you have a virtual assistant that runs your business for you and offers patient education and education for you and your staff as well.
Absolutely. Most of my patients are Medicare, Medicaid. I don't think they could afford the supplements.
Doctor, I understand that. In a lot of practices I work with, we have this same situation. What percentage of your patients are private pay? So then you get that answer. Doctor, again, in the offices that we work with, we initially start by targeting 10 to 20% of patients that might have interest in supplementation. And I will tell you, in the practices that are heavy Medicare and Medicaid, you would be surprised what people can find money for. Additionally, I do have some practices that take their retail profit and put it back into what we call scholarships for their less fortunate patients so that they can offset the cost of the supplements.
I love that. I've gotten such a great response from that. And that goes to another question too. People will say, I don't want to make money off of anyone. And I'll say, great, we'll set up a scholarship fund instead. Or let's do it just to help bring on board another staff member to make things easier. But the other thing is I ask them to qualify how much are Medicare and how much are Medicaid. Medicare being patients that are basically a certain age, and Medicaid being patients that are on, aid because of financial need. I can tell you that my grandparents, being on Medicare, still have a pretty big supplement budget that they've been able to sustain. And it's something that's non-negotiable for them. And so, I'll give an example, a personal example like that. And Lynn, just like you said, telling people that, you'd be surprised what they can find money for. If those are those same patients, and depending on the provider, I can be a little cheeky in my responses, but depending on the provider, I could be like, I was just in your waiting room and it looked like there were a lot of tattoos out there, a lot of fresh looking tattoos. And that's definitely cash pay right there. So if they can afford that, again, doc, you'd be surprised what people can find some money for. So.
And as of our conference last weekend, this is another asset we offer in the prescription program. So I haven't presented with this yet, so I'm not quite sure how it will roll. But doctor, as a benefit of having a nutraMetrix portal business, we're able to offer your Medicaid, Medicare patients reduced prescription costs. And so for everybody that doesn't know, around September, there is something that occurs that's called the Medicare donut hole. And that's where Medicare people run out of insurance coverage. So their drugs that were covered under Medicare now become out of pocket. I used to rep pharmacy cards for a while, so I know that program will be very well received, especially this time of the year.
Cool. I didn't know that.
Yes.
That's awesome. That's really good to know. I don't like making money off my patients. That's unethical. I usually, this is where I was going to bring up the scholarship offer, but is there anything else you say, Lynn?
Yep. I'll say, doctor, some of our providers feel the same way. We understand. We offer you the ability to offer coupon codes to your patients. So they're basically buying the products at cost, but you're knowing that they're getting a quality product with a superior delivery system.
Awesome. How about this one? Pyramid scheme. I don't do MLMs. Do you get that, Lynn? Because I don't get that one.
Very rarely. And, I've been around in the medical world for a while here in Buffalo. So I'll look at the doctor and say, really, do you think I'd be involved in a pyramid scheme? We'll have some fun with it to lighten the mood.
Yeah.
And then I'll say, let me, explain to you how we're not. And I'll sit down with them with, the nutraMetrix business model.
I'll ask what they mean too. I'll say, I don't know what you mean by that. And, or I'll say, like, do you mean like Mary Kay or Tupperware? Like, I'm not doing Mary Kay or Tupperware. And then I like to use hyperboles, so I'll say, like, do you mean like Mary Kay and Tupperware? Like, I don't do Mary Kay and Tupperware. And I don't know, I'm young, like no one's really asked me to do anything like that. That sounds like something that my grandma used to do. And so I'll just kind of show it's so antiquated. So then if they try to bring up anything else, it's like, I don't know.
Another thing I'll say, again, based on the Buffalo, New York marketplace, Amway went hot and heavy with the physicians here years ago, and they all kind of got on board. So I'll say to them, what is your experience with multi-level?
Yeah, that's
to
a good
see
question.
If they've been involved in something previously.
Yeah, right. And who knows, maybe they're looking for something MLM, and I'll never forget the time when my dad asked his NC, is this the type of business that has rah-rah events? And she said, do you like rah-rah events? And he said, I love them. And so, you know, his first event was to go to Miami for World Conference, and he was psyched about it. My dad loves the fireworks and the dancing, and him and Fat Joe have a really great relationship. I mean, that's my dad's personality. So I also, yeah, I wouldn't discount what they're saying. You know, I don't always take it as meaning something as negative as you think.
And a family member might have been involved as well.
Oh, that's a good point. Yeah. Yeah.
Right.
True. Margin is too low. I only get this in certain industries. I definitely don't get this personally from providers who don't sell product. I sometimes will get this from my heavy hitter sales people. You know, people, maybe it's medical aesthetics. They have multiple lines. So, I mean, Lynn, what's your answer? Or do you even get this?
I do. And I have a salon owner in my organization that broke this down in a really easy way.
Oh.
So I understand that your shelf space, doctor, is prime landscape for retail profit or product. I understand that. And yes, when you look at our difference between retail and wholesale, the spread isn't what you're typically used to. But when you factor in our royalty checks or our commission checks, depending on the wording I'm going to use, you will find that it's equal or superior. And in addition, because of the way we help you register your patients and steer them towards auto ship, it becomes a residual for you, and that even increases the margins more.
I'll also ask another question, and I'll say, what are you looking for in a margin?
Yes. And usually if they're asking this question, it's about a 50% markup.
Yeah, yeah. I mean, you never know and the other thing is only where it's appropriate and we're doing something with TLS, I find I can play with the margins a little bit more with TLS.
And if you have this type of situation where you're saying it's like a med spa, where you know they're product driven, you should almost ask that question in the discovery meeting. What types of margins are your products currently producing for you?
That's a good point.
And I also like to factor in this kind of a margin situation, what are the minimum requirements when you place an order? Because a lot of companies have $100, like hundreds of dollars of minimum in an order. They won't ship one product.
That's a great question. I like that as a side. I do often say that in my proposals, that we don't have any minimums. Great. How about this one? I don't have enough patients.
Okay, so is it something that you're looking for more patients? And then if they say yes, well, in part of our nutraMetrix rollout, we help you with marketing. And when patients are looking for practices that are geared with health and wellness, any of the Facebook groups that I participate in that are health and wellness, they're hungry for doctors that are advocates for their health and wellness. And we can actually turn this into a marketing tool for you to build patient share.
Yeah. I mean, there's been times where I've overpromised myself too. So you just have to make sure that you're not becoming a free employee for someone. But I do think that it is a great way where you can say, you're going to stick out from other providers in the same space. Yep. Just like you said, I'm happy to help market you. I have ways we can network. We have some local events, I can get you involved in. Cause like you, Lynn, I mean, I'm involved in a lot of, networking events and associations, and I just know a lot of people. But I guess I would just, to the NCs that are on this call and listening to the replay, I would just caution you to not overextend yourself as well.
And I'll give you all an example. We have a pediatrician in our group, and she has a unique business model. She has a membership fee, so she doesn't take insurance, and she started ground floor, like no patients. And her membership model is based on 500 patients. So right now she has, I believe, like 75 families, but she was still able to appreciate getting involved early on and adding this as one of her services to attract families.
That's cool.
Yeah.
Love that. All right.
And it's sometimes like a part-time chiropractor, right, that will say that to you. I get that often. I don't have enough of my own patients.
Yeah, or brand new providers will sometimes say it. I mean, same thing I'll say, you know, we don't have any minimum inventories. Like you can just start off with products for yourself and send everyone to the website. Maybe, you know, one bottle or something for your shelf. Staff is way too stressed to take on any more tasks. I love this one. How do you respond to this, Lynn?
Oh, gosh, again, I sound like a little bit of a broken record, but doctor, I hear that everywhere I go. You know, we're finding that as the reimbursements go down, the staffing goes down to keep your practice afloat. Our system is so turnkey and seamless that if we start with just a few different products and I work with one staff member, it really won't detract from their day, I promise you.
I'm going to disagree, Lynn, that I don't ever make any promise. Like I never promise anything to anyone, but that's okay if you do. I mean, it's just, and again, I mean, I like that we're doing this because I think that Lynn and I are very similar in our background, but we also say things a little bit differently. So, I mean, I will also ask, you know, there's two things that I might say to this. One, I might say, you know, again, I totally get it. Do you think that more money would make a difference? Like, would you like me to factor that in? And the other thing is when you show a proposal and you show that there's a system that could bring on board, you know, let's just say an extra, you know, $40,000 in a year, you know, hey doc, do you see that this could be something that could be self-sustained to bring someone on even a part-time basis, you know, and even if the first year it's 40 grand, it's just going to grow from there if you had someone cultivating it. Do you see how this could all be self-sustained and we should actually find someone else?
And I think when I say promise, I mean that I'm not going to be a pain in that person's, you know, I won't say it, but I'm not going to be aggressive, wanting more products in the office. I'm going to meet that person where they are. I'm going to become their friend. You know, I'm going to bring them a cup of coffee when I go and sit with them, or I'm going to make sure I go on the tail end of their lunch hour because they've said that's the best part of their day. I don't make it about my schedule. I make it about what works for them in this particular situation. And I find once they get to know that you respect their time limits, that they're more than happy to see you.
Totally agree. Yeah. Awesome. How about this one? My partner doesn't think it's a good idea.
I just think that's a way of getting rid of you sometimes.
That's exactly what I was going to say. Yeah. I mean, I can tell you that when I don't want to talk to people, you know, and I do this with a lot of like financial people, like I'll say, yeah, great. That's a great idea. Like, let me just ask my husband. Like, come on, guys. If you know me, like I make the decisions, you know, no, I mean, to Dan, if he's watching this, like you're totally awesome, dude. I love you. And no, I mean, we do make them joint, but there's some things that like, it's not even worth running by them. And so it's easier, we have an agreement. I'll just blame it on him. So
Yeah.
this is the way I get rid of people, and I'm pretty sure it's just a way that they're getting rid of you.
Now, I know Dr. Nancy had asked this question, and I followed up with her on Facebook, and I asked her to expand upon it a little bit. And
Okay.
she said that she had done the discovery meeting and the proposal meeting and gotten really good feedback. And then she got this objection. So I would, like you were talking, start asking questions. It seemed like you both were receptive during the discovery meeting to exploring more. When we did the proposal, you all seemed excited and on board. What happened? I mean, it might just be that they Googled Market America and something crazy came up.
Totally.
Or somebody said to them, that program didn't work for me, or, you never know who got to them. If that's just not a deflection of get away from me, somebody usually got to them.
Yeah. Yeah. You have no idea. No idea.
Now, in one of our very first accounts, this happened. And it was, and I have permission to talk about this. One of the doctors was already very holistic, and her partners were not. They kind of said, well, those patients are high maintenance, so you can handle them. And she was one of the partners, and she said, guys, I'm going to bring this in. It's not going to cost our practice anything. I'm going to pay the nutraMetrix consultant to be an in-house nutraceutical consultant for me. And we started that way. And now the whole practice is on board. Because we didn't push it. We just got permission for her to pilot it.
That's cool. Yeah, I would just ask more questions. I mean, at this point, if it is just, them basically nicely saying no, ask some questions about it. Is there any way that we would be able to do this? I think we're going to end on this question. This was the one I really wanted to be able to get to. And if you guys had any other questions that weren't answered, we can absolutely do this again. We also you can tag us in the Facebook group, and we'll be happy to answer some more objections. I don't know if anyone has another answer for any of the ones that we've gone over, but I just want to leave you, before I'll let Lynn kind of close it out, I just want to leave you with, just know, whether it's a nice no or really just a obstacle in disguise. I always think that personal stories win out every time. So when you just tell your experience, especially if you did feel the same way, if you truly did feel the same way at one part of it, whether, price or time, right? We all also were presented with the thought of the unfranchised Market America and nutraMetrix as being part of our lives. And so you may have also had some objections. And so, what were some of those for you? And, just remember too, that 80% of sales are made in the 5th to 12th contact. You're still relationship building. And so how you handle yourself, the energy that you give off, all of these things are really important while you're in this courtship phase. Lynn, what would you like to end with?
Practice with somebody, role play. Be kind of mean in your role playing as far as being tough and really making that other person work for what they're trying to achieve. It's only going to make you stronger. And if you have the ability to videotape yourself, do it. It's really a useful tool if you go back and watch yourself.
Awesome. I totally agree with all of that. All right, gang, have an awesome Thursday. And thank you so much for joining us on this webinar today. Thank you, Lynn.
Welcome. Thank you.